Hello, and thank you for joining today's show, the Woburn Spotlight. I'm fortunate to have with me a repeat guest, Senator Friedman, with me today. So, Senator Friedman, it's always good to catch up with you, and I think we have a lot to catch up on today.
Hi, Tyler. Nice to see you. You're looking well, which is good. Hope your family is well, and I'm glad to be here.
Family as well, and I hope the same is true for you as well.
Yes.
Awesome. So, for anybody that hasn't seen a past episode or know who you are, Senator Friedman, I think many in town do. But for anyone that's new to the show or new to you, do you mind just giving us a 30,000-foot flyover of who you are and what you do?
Well, I am the state senator for the 4th Middlesex, which includes the great city of Woburn. And this is my second term. I came to office after serving with Senator Ken Donnelly for 10 years as his chief of staff. And currently I am the Senate chair of the Healthcare Financing Committee and the vice chair of Senate Ways and Means.
So right now, I know talking prior, your schedule's very full, meetings and Zooms, and I'm sure that this new pandemic has shaped the way that you do your job now. How has some of this affected your role in government at a state and local level?
I think that my thoughts have been shaped a little more firmly in what I have always believed in the role that government is, and that is to be the mediator and to ensure that our residents have equal opportunity and access to the things that they need to be successful. It is not our job to make people successful, but it is our job to ensure that people have those tools. And those are things like access to housing, access to good jobs, to food, and to healthcare.
So with everything that's going on over the last couple of months, it's affected life on many levels for, I'm sure, your residents. What are you hearing from your constituents and people in passing that's kind of tightened up some of those beliefs that you already, held near and dear to your heart?
Well, I think one of the first things that I've been hearing is, and it came early on, was people's concern and worry about unemployment. When the governor basically closed businesses and had people stay at home, the effect, as you would imagine, was profound. And many people needed access to unemployment insurance, and they needed it quickly. That is a role of government. And the government responded. They increased the number of people, first of all, that help with unemployment. We also had the state reached out to the federal government, and we got money from the federal government to help people with unemployment. We extended the unemployment insurance, how long you can be on unemployment. So those were some things that government did that I think are absolutely critical and necessary so that we can take care of our residents in a time of crisis. I think that's a very good example. Another example is people looking for healthcare. This has been a big issue for people in the district. Like, can I see my doctor? How do I get to my doctor? I'm feeling sick. And so we've helped people navigate the system and get them the resources or to the resources they need so that they can take care of themselves. I've also heard very, very mixed, we must not open up versus we have to open up right away, everything. And, so that those two opposite positions have been coming across quite a bit.
I'm sure you really get both sides of the spectrum with that conversation. In your role, how do you navigate that, right? With such an interesting environment that we're in?
Well, the first The first thing you have to understand and accept is that you can't make everybody happy. Some people are going to hate me because I support one thing, and other people will hate me because I support another thing. And that's the job. There's no getting around that. But this is especially true because we don't know the answers. We don't have a roadmap for how we get back to pre-COVID-19 days. And so what I try and do is, first of all, acknowledge that both sides have legitimate issues, concerns, and valid points, because they do. If we all stayed home, didn't go out, we would reduce the curve, we would keep people much safer, and we would have many less deaths. If we don't open up, people don't have jobs, they can't pay their rent, they can't put food on the table, their kids aren't getting an education. I mean, these are all valid concerns. So what I try and do is base my beliefs on science and what the science is telling me, and understand and accept that the science changes because we're learning as we go, and that we have to try and balance what we do so that we can be as safe as we can, but at the same time, we can let people get back to work. And that means that we open up, and we open up a little bit at a time, and we've got to measure how that's going. And if we have to pull back, we have to pull back. But I think a very slow, cautious approach is the best way to go. And it's not going to work for everybody. And I acknowledge that.
Certainly. I appreciate your answer there. I can only imagine how difficult it can be to navigate those waters. From your point of view, busy as can be, I'm sure, where do you see room for improvement or opportunity at the state level or the local government level to really excel over the next even 30 days, 60 days, or even next year? Where do the opportunities lie to succeed?
I think the opportunities lie in keeping to the science, to make sure that we understand what we can do and can't do, keep up to date with all of the new opportunities that are coming out in terms of testing and tracing and vaccines or treatments. And I think we really need to support our medical community because we are so good at that in Massachusetts. At the same time, we still need to support people as they navigate back to work or back to school. I think the state has a role to play in making sure that there's childcare for folks, that we have a very robust plan for getting back to school, for kids to get back to school. And I think we can excel at patience, because it will take a lot of patience. Because again, I can't stress, it's not that anyone's holding anything back, it's that we don't know. And we're all navigating as best as we can.
The playbook's being written.
The playbook's being written as we're playing the game. Yeah.
So it's I don't envy you in the role and the task that you and your colleagues have in front of you. It's a challenge, it's an opportunity, depending on how you want to look at it. But I've appreciated hearing some of the heartwarming stories and the great things that are happening among the community as well, not necessarily just focusing on the negative. To that point, have you heard any really cool things that you'd be comfortable sharing in the community or beyond?
I have heard a lot of really cool things. I early on got some calls from doctors who had retired, and they called to say, I don't want to be paid, I don't need any compensation, I want to come back, I want to, can you help get me back in so I can, I can help people. I got a certain amount of those, and that was pretty, that was sort of right off the bat. People were like, what can I do? The number of people in our communities who just started sewing masks, and we all said, oh, those masks aren't right, those masks aren't. And then you find out that in fact, they're fabulous, and we need all of them, and people just did it. I have a neighbor up the street, and quite old, and people just automatically set up a weekly who's going to get food this week, who's going to go shopping this week, and people just haven't. I was in Billerica at their food. They every month they have a food pickup where people call up and they get in their cars and they place an order. They come in. There's volunteers and they just put the food in the car. And if it's a family, they get extra. And it just happened. And people didn't. We didn't have a committee. We didn't, spend a lot of time in a meeting. People just did it. So those are some of the things that have just happened spontaneously around me. And I am quite taken with the incredible goodwill that I see throughout my district, and the need and the desire to help people is pretty extraordinary.
That's a great example and a powerful example, especially. I know I get a good smile. I just even looking around the local area of what's happening. I in parts, and I'm sure you're on group discussions, group calls, but I know you get a lot more granular with your work on a committee level. How has this changed your work at a committee level? Have you gotten busier at a committee level, or a little less busy with everything, or how does that work?
We have gotten much busier ever since this started. And I think part of the reason is because it's healthcare. The committee is healthcare. And I know that as the chair of the Senate, I've been the liaison or kind of responsible for negotiating or keeping in step with the administration so that we can get things done, like telemedicine, telehealth is something that the Senate had done a great bill on, and then we talked with the governor, and the governor did it through executive order. We had a scope of practice bill, which allows healthcare providers to work to the top of their license without needing to be supervised, which means that a nurse practitioner can see people on her own. And we got that. We did that bill, and then the governor took it and did it with executive order. We did a liability protection for healthcare workers. So that's what we've been doing. We've been really working on what parts of the healthcare system need to be in place and be functioning so that we can get through. First it was the surge, and now it's the post-surge. How do we get back to making sure that people have access for their everyday healthcare needs? So it's been very busy. I've done a lot of work with the hospitals on listening to their needs and making sure that there's enough financial stability so that our hospitals continue to function. It's all of the pieces of the healthcare system.
I'm sure. And before, you mentioned support for that healthcare system. What does support look like? Is it financial, or is it go beyond just finances?
It's a combination of certainly finances. I was on a call, and I think that I want to get the number right, but the amount of money that hospitals are losing in a month is around the $100 million mark. Yeah, it's enormous, because so much of what they do is what we would consider elective.
Okay.
Now, an elective means I might have a heart condition, and I'm waiting for some kind of procedure, but because my heart is not failing at this moment, that would be considered elective. But you still need that surgery, right?
Sure. Yeah, absolutely.
But that has stopped, right? So that we could be sure that we had enough beds for people who came in with the virus. So there is a huge financial loss, and hospitals and providers very much need support. But the other piece of it is workforce. We have certain workforce shortages, and that has been exacerbated by this pandemic. You really see it in long-term care facilities, nursing homes, congregate care facilities where people live together and are serviced by workers. personal care attendants, people who come to your house. Those are all areas that are absolutely critical to not only keeping people healthy, but keeping them alive. And there is a real shortage, a lot of which is due to the rates that we pay those workers. So support is getting a workforce that's adequate to meet the needs of our most vulnerable residents. So that's another area of support. Personal protective equipment, PPE, which we hear about all the time, huge issue, absolutely needs the government to, to
Okay.
step in. And because our federal government did not step in and would not help, it was left to the states and businesses and private entities to try and address the problem. And it's been quite a struggle.
Is it still continuing to be a struggle? I don't hear as much about it in the news, but I'm sure it's still out there.
I think it's not so much a struggle in the hospitals, but imagine, Tyler, when every business opens up, everybody's going to need some kind of PPE. And
Yeah.
where is that going to come from? And, if
Great.
you're Fidelity, you have a lot of buying power and you have resources. If you're Bob's Auto, not so much. It's like, where do you go to get that? Or if you're a single independent restaurant, where do you go? Or you're an independent dentist. So I think it's going to be very uneven. And again, because we don't have the federal government doing what I believe is their job, and that is to ensure that their citizens are protected, we are left, the state is left to do it on their own.
Interesting. I'm sure people are reaching out to this point to other issues as well, which brings me to another question for you. I know you are very local and you always hold office hours at the library, coffee shops. How are people reaching out to you right now, and are you able to hold virtual, office hours?
I haven't held any virtual office hours, but I've been on Woburn. I'm talking with you. I've done my other communities. I've let people know that that we are answering the phones. We check in every half hour. We've been responding. We've lots of constituent services, and we have I have a great team who's really stepping up and helping people. I have a great website which gets updated every single day with wonderful resources. And I send out a weekly bulletin to let people know what's going on and what's new. And again, letting people know what the resources are if they need help.
Appreciate that. I'm sure people can find you if they need to. I know you're very accessible.
Yeah, thank you.
My final question, I guess, for you as we slowly wrap up here would just be in summary, you had to leave, one message to your district right now, or even beyond. What would that message be?
Follow the guidelines. Follow the guidelines when it has to do with wearing a mask and personal hygiene, washing your hands, and don't let up, and don't go out without one, and don't let anyone in your family go out without a mask, and keep washing your hands, because that really, really makes a difference. And right now, that's what we have to protect us.
That's a great place to end our meeting. I appreciate all of your time. You've always been very gracious with myself and the Woburn Public Media Center. You're always a great guest to have on. So, Senator Friedman, thank you. I appreciate you being with us today.
Well, thank you, Tyler. It's always great to talk with you. It's a lot of fun. So thank you.
It is a lot of fun. And, please join us for our viewers out there. This is the first Zoom we've done, or I've done as a part of this. But please join us again next time for another episode of the Woburn Spotlight.